During an exam with a patient or client, we are talking throughout the entire procedure. We are talking through every step. And if with each procedure, with each step, I'm asking for consent. I'm asking if it's okay. Do I keep moving forward or would you like me to stop?
I find it's very important to avoid language that can cause re-traumatization. So I ask patients if there's certain language they would like or not like me to use during the visit. I also make sure that if a patient is having a pelvic exam, that I can use certain language, like instead of stirrups, I can say leg rests. If I think it would be helpful for the patient's legs to be more lateral, I'll put my hands on the outside of their legs and ask them to be in charge of moving their legs to touch my hands if that feels safe.
Sometimes patients really like to kind of be like an active participant in their exam, just checking in with patients. How are you doing? Is this okay? And sometimes during the exam, it may be more challenging to actually find the cervix, obtain a sample, kind of do what you need to do, and just checking in with patients. This is what's happening. It's taking me a little bit longer. Are you okay? Is it okay to proceed? Do you need a break? Do you want me to remove the speculum? So kind of just checking in with patients throughout the entire exam.
If in our conversation with the client, with the patient, we hear things that maybe alert us to maybe needing to speak louder, speak softer, speak slower, or if we are feeling like maybe they don't understand what we're saying, asking them, is there a better way that I could explain this to you? Or is there another way that we can get this information together? Just letting someone know that they can stop an exam, stop a procedure, or stop an engagement, like not have to communicate anymore, is providing them with the ability to feel powerful in a situation or an environment where they would normally feel very uncomfortable or maybe very disempowered.
Consent is ongoing. You want to make sure that you get that. So in the midst of the procedure, check in, ask. If they no longer become comfortable, okay, I'll stop. We don't continue. We don't just say, well, let's just push through this last little bit. We stop. We honor the boundaries because, again, this is around trust.
If a patient is unsure if they want to proceed with an examination or say no, I start by validating that experience, and I also start by commending them on respecting their own personal boundaries.
Always remember, for the patient, although you're seeing this as just in order of maybe many patients in the course of a day, for them, this is a sentinel event in their day. So you have to let them be the lead on it.
It is not easy, especially patients who've had trauma where someone else has made decisions for them or taken away their own control over their own body choices, to be able to do that. And that's a very brave and important act in terms of their healing. What I then do is I have a conversation about what the risks and benefits of the exam will be, and then see if they would like it at a later time or if that's something that they don't want in their care at this time. If re-traumatization occurs, if the patient feels triggered at any moment, this is another opportunity for healing. You are a safe person who will show them that they are in control. When they say stop, you respect that boundary. You allow them to get dressed if they're undressed. You debrief with them after, see what resources they may need, and continue to reestablish that they are in charge. And remember, re-traumatization is not about you or you doing something specifically wrong. It's about centering the patient and what had happened to them. It's not something to blame yourself for. It's something for you to use as an opportunity to help your patient in that moment.